sir.
Oh my gosh. Rabies, vision complications, and butt copies gone wrong? What? Today we are back at it reacting to the hilarious medical scenes and emergencies from Beavis and Butthead number 3. Alright, let's dive right in.
Beavis!
Yeah, Butthead.
Uh-oh.
I hate this stupid game. Choking. You're choking?
The universal sign to show that you are choking is to put your hands like this around your neck.
Chicken. You're choking your chicken?
The chicken. Yep, call
Why
911.
don't you call? You're closer.
Now, if you don't get it out in time, the person's gonna pass out because of decreased oxygen. And then you can continue to do abdominal thrusts.
1, 2, 3, 4.
If that doesn't work and the patient becomes unresponsive and doesn't have a pulse, then you start CPR.
If you'd like to make a call, please hang up and dial again. Emergency services.
State your name, your emergency, get to it right away, and maybe your location and callback number in case you get disconnected. Get it over with really quick, and then that way they can dispatch whoever they need to dispatch quickly, and then continue to get the information from you about the situation and guide you on what to do next.
What's the emergency, sir?
Get to it.
Is there an emergency, sir?
Oh my gosh. His color is like an eggplant now. So there you go. He's turning from red to purple, and the next thing we got is gonna be blue.
Listen carefully. Have you Heimlicked the victim?
Have I licked his rectum?
The Heimlich maneuver. Take your hand, put a fist just below the xiphoid process, which some people call your solar plexus, and you're trying to force out food that is stuck in the airway itself.
Soaring through the air.
If you want to save your friend's life, you need to perform the Heimlich maneuver.
He's not really my friend.
If you're by yourself, you can do a Heimlich maneuver on your own. You can try to use your own fist, but the easiest thing to do is the edge of a chair or like the edge of a smooth table. Force your body against it to try to push it out.
Every restaurant in this city has a sign posted describing the procedure.
Oh my gosh, he left to go to a restaurant to see the procedure? Come on.
Hey, Butthead.
Oh my gosh. Now went from purple to blue. So what would you do in that situation? Call 911, check for a pulse. You check for the carotid pulse, which is right next to the trachea. Put your 2 fingers, don't use your thumb because you can feel your own pulse in your thumb. It's called look, listen, feel. What you're doing is putting your ear to their mouth area to see if you can hear them breathing, feel them breathing, and you're looking down the chest to see if their chest will rise with breath.
Wash your hands before returning.
Oh, he saved his life by accident. As a last-ditch effort to try to help somebody, I do not recommend to step on somebody. Don't kick anybody. Don't step on anybody. The colors are coming back. Good job, whoever created that. Is he okay? Maybe, but without oxygen, you can have something called anoxic brain injury. So you can actually be losing brain cells. Time is brain. The longer you wait, without oxygen, the more dead cells are occurring in your head.
Beavis, you know what would be cool? You should, like, copy your butt.
Oh, yeah.
I don't think I've ever copied my butt, but I've seen plenty of funny photos of such. So,
Here.
up on there. Oh! What?
Cool.
Yeah, no. Ow. He probably has some lacerations and maybe some impaled pieces of glass versus whatever it actually made of. Maybe it's some sort of plastic polymer.
Hurry up and get that moron out of there. I need that copier fixed. Oh.
Sir, we can't move him. His femoral artery may be cut.
They are worried about the femoral artery. So your femoral artery is actually more superficial, just in your groin on your anterior component of your body. It's actually really good that they're pausing for a moment before reacting to kind of assess the situation.
The only way to look is by moving him off the copier. But if we move him, he could bleed out.
If you cut your femoral artery, how quickly would you die if you did absolutely nothing? 20 minute, 30 minute, hour? It depends on where the femoral artery is cut. If it's more distally in the leg, you can tourniquet above it, and that is your last ditch effort. If you can see it, just clamp it. If you can't see it, but you see a hole, stick your finger in the hole.
You could copy his butt.
That would be cool. Ow.
That's actually pretty funny. Funny idea to try to get a copy of his butt. On the other side, probably hit the stuff below it, so it probably wouldn't work. Oh, jeez. Every time I see like a dog that's foaming at the mouth, what do you think of? Rabies.
You have rabies? No. You have rabies?
If you have any concern, get to the hospital, get evaluated. We have rabies vaccines as well as immunoglobulin, which you will need if you do get a bite. Oh. Oh. This is intense while you're watching. If this wound would come to the hospital, we would give antibiotics, pain medication, give IV fluids to make sure the blood pressure and heart rate are within normal limits. And then obviously it needs to be repaired. If it has so much destruction from ripping and tearing, you'll need to see probably an orthopedic surgeon or plastic surgeon, take you to the operating room, kind of wash it out, clean it.
I don't suppose you brought the animal with you.
He wasn't, like, very friendly.
Yeah, he doesn't like me.
You have the foaming at the mouth.
She's foaming at the mouth!
And it's due to the fact that you have like dry mouth, you can't swallow your saliva. It has to do a little bit with the worry of trying to swallow, and it has to do with your central nervous system.
In a suspected case of rabies, the animal has to be destroyed, of course. And to check for presence of the disease, we cut off the head and dissect the brain.
In situations where there's a concern for rabies and you have the animal, there's a couple different things that you can do. You can observe the animal, but the only way to definitively diagnose rabies is a brain biopsy.
Better start treatment.
Does he have to get a shot?
No.
Cool.
You have to get 18 of them, Rod.
Depends on your regimen. You will get 4 to 5 vaccinations over a period of time. Day 0, and then a week, 2 weeks, 3 weeks. And so you actually have to inject it around the wound, most of it, and then actually throughout the whole body.
In the stomach.
Yeah, no, they're all over the place.
This sucks.
Yep. We don't really use those type of syringes that have the finger holes in there. Most of those are at like the dental office.
The good news about rabies is that treating it no longer means a series of painful injections into the solar plexus. New vaccines require only 5 simple shots in the arm.
Hey, Beavis. How come that stupid doctor didn't know that?
We get the same thing. We're like, oh, but the TV says this is what it is, versus the doctor who's probably up to date on the information.
I couldn't help but notice how close you were holding that magazine. Have you ever taken an eye exam?
Oh, geez.
I hate tests.
Well, at the end of this one, you get a sucker.
Cool.
Oh, nice. There you go. He is at the eye doctor. So there's 2 different types of eye doctors. There's an ophthalmologist, which is the eye surgeon, versus an optometrist, who mostly deals with the eyeglasses, the vision itself, as well as doing some of the procedures that an ophthalmologist can do.
Cool, a Viewmaster.
A Viewmaster! Oh my gosh. Does anybody know what a Viewmaster is? If you do, let me know in the comments.
Can you read this line?
BHZF.
But
That's so funny. He's trying to actually read the word versus saying the letters. You need to be explicit in what you're trying to ask somebody to do.
Shut up, wipe.
Just wear glasses. I love it. But yes, you're always embarrassed to wear glasses. If you need glasses, wear the glasses. They're cool. There's so many different types of frames out there. He's having trouble seeing. The eyes are amazing. So you typically, after putting on new glasses, your eyes would adjust in minutes. There was even a study that showed, like, if you wore a pair of glasses that flipped the image upside down, your brain would then flip it back so you can actually see everything normal again. This was really good. Who doesn't love Beavis and Butthead? It's like such a throwback to all the things I might have grown up with, my siblings grew up with. And if you guys enjoyed this, please check out this playlist right here. And as always, make sure you subscribe, turn those bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.